No. Just gently.
Oh,
There.
So you came in with low back pain, right?
oh man.
And what kind? Was it going down your legs or anything? Both legs or one?
Both this time.
Okay, so you had a lot.
Yeah.
The
I have
problem.
L4, 5 fused. And he told me when I fell flat on my butt. I passed out in the urgent care meter. Fell flat on my butt. Stove that up.
So this spine was born in 1942.
War baby.
This is a World War II spine.
There it is.
Yeah. So there's the hardware there, 4, 5.
All right.
You can see the surgical fusion there.
So everybody, this is Clyde. And we have an interesting case here. So we first met Clyde in May of 2022. And he's a golfer. We had left leg pain to the point where we couldn't golf. We also had a challenge. The challenge was we have a fusion at L4, L5. But we had an L5 disc issue causing sciatica down the left leg. So obviously we cannot treat or work on or adjust L5. So what is our option? Well, there's lots of options. There's soft tissue, there's muscle stim, but none of that worked. He's already had PT and everything else. The only thing that worked was adjusting the sacrum specifically underneath the fifth lumbar and not disturbing the fusion. And we did a series of adjustments, probably 10 or 12 adjustments, and that leg pain pretty much vanished. Then we had a flare up a year or so ago on the golf course when a dog tried to bite him. Right?
Yeah, one of them
Yeah.
German type, Belgium something.
But he was doing great, so we got through that. Then we have the most interesting and not good thing that happened. Back in October of last year, so several months ago, Clyde was at a urgent care, and through whatever mechanism, you blacked out, passed out,
Right.
because the heart wasn't working good.
No, it was just, actually it turned out it was dehydration.
Okay,
So you were at urgent care, not for your back though, right?
no,
Okay, for dehydration. Okay.
I was there because I thought I was having a blood clot in my ankle.
so
Okay.
unfortunately he
Thought he had a
blacked
blood clot.
out and fell, and he landed on his butt. And you can see this quite clear in this x-ray, that the surgical screws were implanted into the center of L5. After he fell, he fractured L5. So the vertebrae has now a L5 compression fracture. So Clyde and I spoke. He was in a lot of pain. I said, look, I want you to go back to the orthopedic surgeon, make sure this is stable, have them do whatever testing before we work on it. Well, he went back, they didn't do anything for him. And then Clyde came back and go, I really need your help.
Yeah.
So I said, okay. So let me show you how we treated this without affecting the old compression, without affecting the new compression fracture, without affecting the surgical implant. So once you come on over here. Face down.
So Clyde is 83, by the way, right, Clyde?
Yes, sir. So we're going to find the anatomy. So what I'm going to do we verify that this is the second sacral tubercle on the sacrum. L5 is here. So we're about an inch below. So I'm going to make a contact, not on the 5, but on the sacrum. And I'm going to lift the sacrum up and underneath the L5 to decompress L5. And it goes right in. Good. No rotation, no trauma, and immediate relief. Clyde, how much better is this back than it was a month ago?
I ain't even felt anything in my back.
He says he hasn't even felt anything in his back since.
Okay.
Just my neck now.
So we're going to work on this posture. We're going to come down the 8th thoracic vertebrae. No. All right, and then we'll have him come back over here.
I even swung my driver twice today.
You're able to swing your driver.
Yeah.
Put it on the green, right?
Were you swinging it or were you hitting the ball?
I hit the ball.
Well, I think because he's been in so much pain for the last 2 or 3 months, he's been leaning forward, and now it threw off his 6th cervical in his neck. And again, we have an 83-year-old cervical spine, so it's, there's a lot of arthritis. So we're going to gently, with a fingertip contact, we're going to get onto the lamina of C6. We're going to lift the vertebrae up and just gently, there.
Excellent.
There we go. All right, young man. We'll see you in a week. You're doing great.